You're watching TechCrunch TV. My name is Colleen Taylor. We're at the Rock Health headquarters here in San Francisco in the heart of downtown. Sitting with me are Sarah Pollet and Halle, the COO and the CEO of Rock Health. Thanks for having us here.
Yeah, welcome to Chinatown.
We're in Chinatown. It's interesting. So just to start off, you guys have some news that we're going to be talking about here, but just to start off, can you explain for anyone who doesn't know what Rock Health is?
Sure. So Rock Health is actually the first accelerator for digital health startup companies.
Okay, so it's a startup accelerator, and all the startups are here in your offices, right? There's a program, and they all hang out here and work on their things.
That's right. We've actually had 2 classes previously out of our San Francisco office, and they were each 13 startups each. And then we just hosted a program for 3 months in Boston, and we had 7 phenomenal startups graduate there. And so it's a very collegial class and a very collaborative environment.
Great. So I definitely want to come back around to the startups and what you've produced so far. But today there's some pretty big news. You're increasing the amount of money that each startup is going to get by a pretty hefty amount.
Indeed.
Yeah, so every startup coming through the Rock Health program will now receive a $100,000 investment from 4 of our partners. It's actually 3 of the partners we've worked with in the past, and one of them is new. And the new partnership is with Kleiner Perkins. We're working with a couple of the partners there, and it was actually led by Mike Abbott, who's been one of our advisors from day one. And so formerly he was at Twitter, kind of helping us out, evaluating the technology of the startups coming through, and then supporting the startups in some of the big decisions they're making on the technology side. But now that he's a partner at Kleiner, he's been able to really strengthen that relationship with us and him, and now they're going to be leading these investments. The other 3 partners are 3 organizations that have been working with us from day one. It's Aberdare Ventures, which is a healthcare investment firm, More Davido, which does both life science and technology, and also Mayo Clinic, which has a small fund that they invest in startups, including some of our graduates. So those 4 organizations will now be investing $100,000 into each startup that comes through our program.
Now, previously, how much money, in the past 2, or I guess 3 cycles that you've had, how much money has each startup gotten?
So previously it was $20,000.
And what does it mean that these investors, that Kleiner Perkins now is part of it? Will they also be part of, giving advice to these startups? I mean, what does this partnership really mean for Rock Health and what the program will be like?
Yeah, well, so the partnership really started because they had been, especially for the investors that have worked with us, and Mike Abbott, who's been with us from the beginning, they really saw the value of the program and the resources that we've created for the startups. And so we have now a really nice track record of startups that have gone on to be successful. And so for them, it's a way to really get in early, support the startups with more money than they would have had before, and hopefully get the startups a little bit more off the ground than they have been traditionally. Especially since a lot of the startups that we're working with have both software and hardware components. Some of them have to go through FDA regulation. Their costs are a little bit higher, and so we want to make sure that money is not the constraint.
And you just mentioned this 3rd batch that just wrapped, I suppose, back out east in Boston. What's the difference been like that you've seen from the East Coast program to the West Coast one?
Sure. Yeah. So we actually just had our Rock Boston demo day this past Friday, and it was a massive success. And that program was a little bit shorter. It was a truncated curriculum, so it was 3 months as opposed to the 5-month program that we had for 2 iterations here out of San Francisco. We also had a smaller class. We had 7 startups instead of 13. And a lot of the startups were a little bit more healthcare delivery focused, so still apps, sensors, platforms, but I'd say the consumer-facing side is predominant out here in the West Coast. Yeah.
And you mentioned this mesh between hardware and software. And when you say that, what do you mean? Because I think a lot of times when people think apps, they think purely software. They don't think of a hardware component.
Yeah. Yeah, well, when we say app, we really mean an application, a software application. And we like software, we like hardware, and especially things that can really reduce costs, reduce inefficiencies, better deliver care, and a lot of times that has a hardware component with a software interface. So an example of that would be a company that you guys covered called CellScope, which is building the otoscope so parents can diagnose ear infections at home. It sits right over the camera on a smartphone and allows parents to just use their device instead of actually having to go into the doctors. And something like that, building the prototypes and actually starting manufacturing is pretty costly. And so we want to be able to give the startups resources to kind of get going a little bit earlier instead of spending so much time fundraising in the first 6 months of their life.
Now, you're still a relatively new incubator. I guess it's been around for a year and a half now or so. What have you learned as time has gone on? Any kind of key lessons that you've learned since starting that you didn't realize at first?
So many. Where would I even begin? Well, it's a really interesting space. It's a growing space. From the first half of this year compared to last year, we had 73% more funding. So it's growing really rapidly, and people from both sides, from healthcare and technology, are getting more excited about the opportunities in this market. I mean, healthcare is such a huge part of our GDP. There's no denying that it's an enormous market opportunity. But what we're really starting to learn is how important it is to have teams that are cross-disciplinary, that have experts on both the healthcare side and the technology side, and that they work well together. There's a very different style of people that work within a hospital setting and those that work in the tech world. And so really finding teams that have a good balance and are both open-minded to what they don't know and both have a knowledge that kind of crosses both of these disciplines is what really is successful. And so we've learned you can't just have a team that's really technical but not open to bringing on advice from medical experts. At the same time, you can't really have a team of doctors that don't know how to code or don't know how to talk to developers. It just won't work.
And now you mentioned style, and I have to point out your hoodies. They're pretty eye-popping, pretty stylish. I guess you'd mentioned that you're just now sort of accepting applications for your next batch of startups.
Yep.
So this helps attract attention.
Yeah, so we have tons of people going around San Francisco and Silicon Valley in these hoodies. They're all with Rock Health, so if you see them and apply, you can ask them questions. And applications are open for 3 weeks, and we hope to see a lot of really great ideas and have another wonderful class here in San Francisco. And
what can startups expect if they get accepted into the program? What kind of vibe do you try and foster here?
Well, we actually, I spoke a little bit about this at our Rock Boston demo day, and I'd say the best way to phrase it is that we really fundamentally believe that happiness drives performance, and so it's a really happy, creative environment. Again, one of the differentiating aspects of our incubator is that we house everyone in the same office space, so people really get to know one another. They talk about their technologies. There's a lot of shared learning. And also, I think we attract very ambitious people. These are technologists who might otherwise be working in different spaces in social media, but they found the passion and the dedication to find themselves in the healthcare space. And so the role of our incubator is really to help those folks network with people who are clinicians and help them build useful tools.
Now, I know, I guess it was last week, it feels like a million years ago, but last week we had the Y Combinator demo day, and there was one startup out of that batch that had previously been in Rock Health. And what's the relationship like with Rock Health and Y Combinator and other incubators? How do these startups move back and forth between these?
Yeah, we've had 3 of the 35 startups that have gone through our program actually participate in both Rock Health and Y Combinator, either us first or YC first. And they've been completely complementary. YC is a lot shorter and it doesn't require office space, so a lot of times the startups will be housed here and participating in YC. And that network and the cachet of being in YC is just unbeatable, and we really look up to them as a very successful incubator and would continue to take startups that participate in both programs.
Great. So what's next for Rock Health going forward? Are there more locations that you're looking at expanding to, more different industries maybe? What's the
oh my gosh, no, healthcare has got us down. I would say, yeah, San Francisco and Boston are really the 2 locations that we're focused on, and continuing to really support the startups that are in our program at the current time, as well as the alum group. We have never to date had really a culture of innovation and entrepreneurship in healthcare. We see that in technology. It's been around in technology for a long time, but this is the first time that we've ever really had a growing culture and ecosystem around innovation in healthcare. And so we think it's really important that we continue to grow and foster that group of people doing good things.
Sounds good. Well, thank you for hosting us and for giving us the latest.
Thank you.